The Centers for Medicare and Medicaid Services has issued guidance to state Medicaid directors, essentially giving them the green light to deny Medicaid to folks that aren't working. Now, this guidance on work requirements in Medicaid is very strategic. It was a letter to Medicaid directors, knowing that a lot of Republican governors are thinking about these Section 1115 demonstration waivers that include work requirements as a way for them to prohibit people that aren't working from getting their Medicaid coverage. Now, a lot of folks are saying this is a move that was done in anticipation of those waiver requests coming, but it's also a way to build a little bit of background and support for the federal government in anticipation that some of those state waivers might be challenged at the state level. So it's giving a little bit more grounds should a lawsuit arise, and you can bet that they will. Opponents are saying this is keeping otherwise eligible people from getting the Medicaid they deserve. It's just throwing hoops and hurdles in the path to Medicaid for people that deserve it most. A lot of people are saying this actually violates federal law and the objectives of the Medicaid program, and hence that's where the lawsuits would come in. The reality is, and you hear this from a lot of the opponents of work requirements in the Medicaid program, that a lot of the folks receiving Medicaid have a disability or a significant health problem, and that's why they can't get to the workforce. Maybe they don't meet the level of disability to have a formal disability determination, but they might not be well enough to work. For everybody else, this is the largest argument. A lot of folks receiving Medicaid are already working. So there's a lack of understanding of the type of folks in a cycle of poverty that might be working, need the Medicaid to get to their care and keep preventative services and immunizations and everything else going. They're already working. A work requirement that ups the ante for them is not going to do anything new. Common reasons for not working, as you can imagine, a lot of these folks are caregivers. So there is also a lack of understanding of what is going on in the Medicaid population. A lot of them are already working. If they're not, there's a reason why. They're not healthy enough to. They might be caring for a sick family member, or they have other obligations. The research out there is showing that work requirements don't work. It is instead keeping people from the care and coverage they deserve. Now, let's talk about Wisconsin. Wisconsin is one of those states that has submitted a Section 1115 demonstration waiver saying they would like to not only put in work requirements, but also drug testing, monthly premiums, and increased obligation cost if folks are using the emergency room. The Centers for Medicare and Medicaid Services has approved Kentucky's waiver. Kentucky was another state asking for work requirements. Wisconsin's waiver looks similar. The only difference is Wisconsin is not going to be as generous in how they define work. In Kentucky, there's a pretty broad definition of work, including volunteering or community engagement. Wisconsin does not include that. There will be a set hour requirement, or you will lose your Medicaid coverage. This is controversial for some. For others, it's seen as a complete no-brainer. We don't want to, it's seen as backwards. You would want people to get access to their Medicaid, to get healthy so they can rejoin the workforce. Instead, this is saying you're not going to get your Medicaid until you're part of the workforce. You can read the guidance yourself on the Medicaid.gov website. You can read the plan for right here in Wisconsin, the waiver request Wisconsin submitted. You can also read our letter to the Centers for Medicare and Medicaid Services telling them why we don't believe work requirements are in the best interest of the health of the people of Wisconsin and of folks generally trying to access health care and coverage and be part of an active economy. You can send us your thoughts. Maybe you disagree with that. You can visit us at healthwatchwisconsin.org and share your opinions, but you can also send us an email or ask a question. Thanks for watching.